think doctors should approach sensitive topics to their patients by storytelling. Sometimes stories can impact people in a way that you might not even imagine. It doesn't have to be personal. It doesn't have to be about the doctor themselves. But I think when you tell your perspective or your experience of, the issue or the topic at hand, it can give a different perspective to their patients.
Sometimes at the clinic, we get an iPad and you're asked questions about sexual activity, mental health, drugs. And sometimes the team may be honest and then some may not be honest. If the team isn't comfortable answering the questions truthfully on the iPad, maybe they'll be more open to answering the questions from the doctor if the doctor asks what their friends are doing.
The most important thing for doctors to know and do is to ask open-ended questions that are often direct. So asking the hard questions about, are you experiencing these symptoms of anxiety and depression, and maybe asking more details about their day-to-day life and pinpointing certain areas that, the physicians think may be high risk. So if they're, a straight A student, well, that's a good thing, but, maybe ask about how they navigate that stress and how they navigate the work-life balance of, doing all of these hard classes and also being a high achieving athlete. So just reassuring them that it's a safe space, asking questions even if they seem okay, asking specific questions and maybe trying to pinpoint certain areas that may be high risk in their lives.
Doctors should take mental health extremely seriously. Even if it is a dramatic teen, it can be minute to you, but it's dramatic to them for a reason. So making sure that you are listening to what they're saying and kind of taking in each detail and seeing where their headspace is, because that could be very telling of where that person's mental health is.